93 FM.
Hey there, good afternoon. Thank you so much for joining us on yet another edition of the program You and Your Health aired on Equinoxe Radio Multimedia. For presentation, I am Immaculate Fogwe. Last week, we looked at some aspects as far as pregnancy is concerned. We looked at some weird cravings pregnant women usually have. We looked at some early signs of pregnancy. This time around, we'll be looking at other aspects. And of course, we have a special guest to answer to all our questions. Right here, I'll be having my co-host, Asa Lucilia. Good, it's time. We'll not have the short break. Hello, Lucy.
Hello, Immaculate. Hello, ladies and gentlemen. Thanks for joining us.
Of course, Lucy, thank you so much for being here. And as I said, we have a special guest. It's the same person we had last week. As due to popular demand, we brought her back so she could answer to all of your questions. Due to time constraints last week, we were unable to answer some of those questions. Hello, nurse. It is a pleasure to have you on Talking Point tonight.
Thank you, madam. I'm happy to be back again on Equinoxe Radio.
My guest tonight is Nga Priscilla. She's a midwife at the Mbopi Baptist Hospital. So, last time we were talking about pregnancy. We're still going to continue with this particular topic. We noticed a lot of people were really interested and they were asking a lot of questions. We want to know from you, is it normal for a pregnant woman to always feel tired?
Thank you for that question. Being tired in pregnancy is normal, because you have moved from your normal state to a pregnant woman's state. This is a period that the fetus is developing, and the development of the fetus in utero is so rapid that a lot of energy is being drained from the woman, and from time to time they feel tired. When they sit, you find them sleeping because they are hosting another person. That's a human being that's developing. All the feeding and all the nutrients that this fetus is getting is from the pregnant mother, and for that reason they actually feel tired because of those metabolic changes in her.
Talking about these metabolic changes, is it normal? How long is a pregnant woman expected to sleep in a day?
A pregnant woman should actually sleep, and the hours should be at least 8 hours in 24 hours, meaning that in the night the woman should sleep 8 hours, and in the day, during the day, in the afternoon, we advise that they should go to bed and sleep at least 2 hours. That will make 10 hours. They should create time to have some time to rest.
And is it dangerous for a pregnant woman to sleep with her back?
Yes, but it depends on the age of pregnancy. Before 20 weeks of gestation, there's actually limited harm. But after the 20 weeks, the uterus is growing and there's weight on it, which now tend to apply pressure on the main vessels in the abdomen, like the inferior vena cava that is supplying blood from the lower limbs back to the heart and then to be circulated to the body, and even the aorta. So we advise them to sleep on the side after 20 weeks of gestation, so that this pressure will not be applied. When they sleep on their back and this pressure is applied on these main vessels, you find them when they get up, they become dizzy, because the supply to the vital organs, the brain, especially the brain, was affected, and they become dizzy. So they should sleep on the side.
And okay, before we continue, we will be giving out the numbers for those who like to join us on today's program. We have 670-547049. I repeat, 670-547049, or 656-622222. I repeat, 656-622222 at the end. And now back to you, nurse. When a pregnant woman starts experiencing dry fluids, or to say draining fluids from her vagina, is it actually normal?
In pregnancy, we understand that there are increased secretions of the normal vagina, but if she should experience fluids that runs down to her pants and even past and going to the legs, it is an indication that the membranes, that is the amnion and the that surround the baby, have been punctured, and therefore it's an indication of an emergency. Any woman that experiences ruptured membranes, as we call it, you go to the hospital. Sometimes it's already a sign of labor, which is just one, but sometimes it occurs early in pregnancy, and it means that the integrity In fact, the house of the baby has been punctured, and it's a risk that baby can easily get infected. That's why when we receive them in hospital, we start giving them antibiotics to protect her and to protect the baby. The womb itself will become infected, and the baby will become infected. So it is an emergency to us. We advise them, should you see such a fluid, you come and we verify. Is it urine? Because sometimes urine, pressure, but most of the time it is actually the amniotic fluid that has ruptured. Come to hospital.
Right from small, we have always been told a woman gives birth at 9 months. But then we have seen some changes as we grow up. We notice some women giving birth at 7, others 8 months. We'd like to know, how can you tell, given that you're aware that it's 9 months, how can you tell you're in labor in such a situation? Maybe if it happens at 8 months.
Yes, we have signs of labor, which can occur at any time, as we are saying. Labor can come at term, that is after 37 weeks of gestation, or it comes before that, and we'll call that preterm labor, but it is still labor. And the signs are, you are going to get regular contractions, where the uterus is becoming tense and relaxing, regular painful uterine contractions. We are calling it painful and regular because there are some contractions. The uterus does not just stay quiet. It sometimes contracts and relaxes, but when they become regular and painful, that is one of the signs of labor. And in addition to that, the cervix will start dilating to show that we know cervical dilation when we do vaginal examination. So when we do vaginal examination, we are able to see whether the cervix has started opening. That's another sign of labor. And as I mentioned earlier, one of the signs is ruptured membranes. Because this cervix has started opening, that amniotic sac will tend to rupture. And other signs in other women are that some start vomiting and some start having diarrhea. It ranges from woman to woman, but the key is that there is pain and there is dilatation of the cervix.
Now, talking about weight gain, at what point do we start talking about weight gain? Is it normal to even gain weight during pregnancy?
Weight gain in pregnancy is very normal because the baby is growing in the woman. That baby too will gain weight. But we have landmarks. The woman should gain weight between 11 to 16 kilograms. When a woman is obese, we expect her to gain less.
Wow.
Because she's already obese. So those that will gain only 10 to 11 in pregnancy are those that are obese. Then women that have what we call a metabolic index, basic metabolic index of between 20 and 27. Those are normal weight women. They should gain weight of at least 12 kilograms. And those that are lower, BMI, we call it BMI, less than 18, they should gain higher, about 16. So weight gain is normal. The baby is growing. A woman who is not gaining weight in pregnancy is a problem. She may be malnourished. She may be having other infections that are affecting her. And a woman that gains too much of a weight in pregnancy is also a problem, because when she becomes obese, the baby too will become obese, will become very fat. We talk of macrosomia, that will have other complications. So we monitor the weight so that it doesn't go out of this range.
What are some of those complications?
One of the complications with overweight is that there will be difficulty during labor.
Wow.
The labor for women who are obese are usually prolonged, and they end up having cesarean section. We end up operating them. The baby too will become overweight. We talk about fetal macrosomia, and they end up having difficulties. Labor is prolonged, and difficult delivery, difficult extraction. Even during cesarean section, to extract a baby that is 4.5 kilos or 5 kilograms is usually difficult. Those are the difficulties that come with overweight, and we need to manage it. We always advise these women on what to take in order not to become overweight. Little of sugars, little of fats, and more of vitamins, vegetables and fruits. Those are what we advise them to take. More of protein. Keep the carbohydrates aside. Very little.
Okay.
So can we say that it is because women are overweight, that's why they're mostly going for the C-section? What are some other factors that can push a doctor to book a woman for a C-section?
Cesarean section is in two sections. There are those that we call elective cesarean section, and those that are emergency cesarean section. With elective cesarean section, it ranges from a woman that chooses to go for cesarean section. There are some that just opt I want to go for cesarean section. But there are other factors in women that the doctor will decide. Because of this, you will go for cesarean section. If a woman who is having fibroids, a woman who has just been operated because of uterine fibroid, the uterus is not healthy, they advise cesarean section. The reasons are numerous. A breach in a primary gravida that is already overweight. Yes, fetal macrosomia, as I said, is one of the reasons that in a primary gravida, a woman who is having pregnancy for the first time, we want to operate them. The reasons are numerous. The other ones that come at emergency are because either there's bleeding, placenta previa, placenta abruptio, or she's in labor and the labor is prolonged, or there's fetal tachycardia or fetal bradycardia. We want to take them to help them. Or there's maternal distress that we think that this woman needs to go for operation. That's what we call emergency cesarean section. The reasons are so many. They are so numerous. They are so numerous. Multiple. 4 babies, we don't expect this woman to just push and deliver because of the complications. So we put them together and then we take a decision of cesarean section.
What about 3 babies?
3 babies, sometimes they will deliver vaginally, but that will depend on their weight and the general state of the mother.
Okay.
You don't just decide that, no. And what are the positions? If they are all lying longitudinal, it is easy. And it doesn't end at that. If one is longitudinal and the other one is breech, you have a worry. And some tend to lie transverse. So the position of the baby in utero will also tell you whether this baby can be delivered vaginally or not. It should also go for cesarean section.
Just to remind you that our lines are open to participate in this program. I guess Lucy already spelled out the numbers, but still, get the numbers again: 670 54 70 49. I repeat, 670 54 70 49 or 656 62 2222. 656 62 2222. Call and ask all those your questions as far as pregnancy is concerned.
And now, nurse, some people really think that this new trend of cesarean section is because most hospitals want to make money. Is this actually true?
No. The issue with cesarean section is that a lot of studies have gone on. Women at first, they will allow them to labor and labor till thy kingdom come, and they may not end up delivering live babies. But because people have studied, they know how to monitor a baby in utero, they know how to diagnose the problems. Innovations have come. The issue of ultrasound was not there at first. But now with echography, you see the babies that are macrosomic, you see the placenta that is anterior or lower lying placenta, that's placenta previa. You see other complications that with just palpation, you will not get it. And that's why women, we observe that there's an increase in cesarean section. It is just because people have become very knowledgeable, and now we are very critical. We want to get the baby alive. It's not at first when we say that calabash, as they will say in pidgin, now only water commode, calabash remain for the no. We want everything. We want the baby, we want the mother to be healthy. That is one of the reasons why you find that cesarean section is a bit elevated. It is not about finances, because the life of a human, it's very expensive, more than the money that they pay for CS. And cesarean section is done also by qualified. Most of our hospitals now have midwives that have bachelor's degree. So the monitoring is different. It's not that before that it was anybody, any TBA in the quarter can monitor labor. No. And then the doctors too, gynecologists, they are well trained, and that's why they.
We have a call on the line. Hello.
Hello. Good afternoon.
Good afternoon, sir. Your name?
My name is Vitalis.
Vitalis, okay.
Yes, I just want to know, for a woman who has delivered maybe for more than, she has delivered more than almost 10 months today, and that she continues bleeding continuously day and night. How, I don't really know what's the problem, so I don't know if maybe the doctor in the studio can maybe give me some guidelines.
Okay. Thank you so much for calling. You got a question?
Thank you, yes.
Okay.
Yes, if I got you right, a woman has delivered, it's already 10 months, and she's bleeding continuously.
Exactly.
That is very, very abnormal. She needs to consult. What is provoking the bleeding? We all are aware that women return to their fertility at different intervals. Some come back to their regular periods even after 4 months, after 3 months. But if you have a situation where she is bleeding continuously, it needs to be verified. Is that bleeding coming from the uterus? And if it is coming from the uterus, what is provoking it? Because the complications of continuous bleeding are terrible, because you will become anemic, and that will entail transfusion and other things. We need to find out where is the bleeding coming from and why is she still bleeding. She needs consultation as an emergency, sir.
Okay. Now, another school of thought have it that a lot of women go in for C-section because some of them are lazy. Not as if because maybe they are tired, they don't want to put an extra effort to have that baby. Is that, as a midwife who has been working with a lot of pregnant women, would like to know your view as far as this modern women are concerned?
Women are not the same. That is true. There are some, the pain threshold range from woman to woman. There are some women that are in labor and they are sitting and smiling. They don't have any issue. They are moving about. But there are other group that once a contraction comes, even if it's lasting 20 seconds or 30, they shout and everybody is aware that somebody is in labor. It all ranges from the pain threshold. And most women that are stressed up, they easily want to go for cesarean section and just have this baby out. And the women that are not supported in pregnancy, most of them, we end up, they are mostly stressed up. Yes, and then they end up with cesarean section. When we are monitoring, we are observing. There should be parameters to put in place. If you are in labor and vomiting continuously, surely you will have imbalance that will need cesarean section. So we put all those together to decide on a cesarean section. Yes, but if a woman decides, the hospital also allows it, that you can choose, but after enough encouragement.
We have another call on the line. Hello.
Good afternoon, Madame.
Good afternoon, sir.
This is Nga Christopher from Bole Bakundu.
You're welcome, Nga Christopher. Mr. Nga Christopher.
I want to find out from the doctor, what are the reasons advanced for male babies to be born defected? Sometimes you see them without penis, and the cases, what are the reasons advanced for this defection? Thank you.
Okay, thank you so much.
Thank you. Reasons for abnormalities in a newborn are enormous. Sometimes it is genetic disorder. Sometimes it is the drugs that the woman was using even before conceiving. That is why when the woman is pregnant, there are some drugs that we just say, don't take this one, don't take this one. That's why from my last lecture I said, when a woman misses her period, she needs to consult to see whether it's a pregnancy. Because there are some drugs that will bring about those problems in a newborn.
Now, there's some, I can call it some sort of new trend, but I'm not quite sure if it's really a trend, about painless labor. There we talk about anesthesia. Can you tell us more about this?
Yes, painless labor is what we are going into. It is a new form of management of labor, and it is new in the sense that in Africa, Cameroon, women they know that they have to feel pains in labor. But painless labor exists, whereby a woman is given what we call epidural anesthesia. This is done by anesthetists, where you are given some analgesics so that even with the contractions that provoke the pain receptors are numbed so that the woman don't feel it. But the labor will progress normally. So it is what we are introducing now into our maternities. And those who have gone through it really appreciate it.
So now is what you're talking about, is it the same as an induced labor?
No, induced labor is labor that is being provoked. Normal, as I said, after 37 weeks of gestation, we consider it as term. So a woman should spontaneously go into labor. But when we are waited 40 weeks, nothing, 41, we don't want it to go more than that. We always want to induce. We induce it mechanically or we induce it chemically. Use of drugs. Those are the methods that we use in our maternity to induce.
So when a woman undergoes a cesarean section, after how many weeks can she carry out her activities normally?
A woman who has been operated, like in our hospital, they use mostly epidural anesthesia, spinal anesthesia. When a woman is operated, 6 hours after operation, we want her to ambulate. So we clean you up, remove the catheter, and then assist you to move around. And after that, we encourage her now to go and ease herself, urinate, At any time, she should sit up and breastfeed the baby, because when you sit up, you have a good grasp of your baby. She should be able to eat but soft things, and it continue. That activity should continue, because active ambulation is what is advised, not only after cesarean section but after other operations.
Thank you so much, Nga Priscilla, midwife at the Bingo Baptist Hospital, for accepting my invitation.
Thank you very much.
Also, it's always a pleasure being with you, Lucy.
Yeah, Immaculate.
Thank you so much, ladies and gentlemen, for staying with us till the end of this program. That's where we'll put an end, and we say thank you for your keen attention. Stay in the company of more interesting programs. Receive technical assistance from Jonathan Babula and Bertrand Bomzini. Bye-bye for now.